What if that new mole on your back isn't just part of getting older but a ticking time bomb? Skin cancer, especially melanoma, is one of the most serious health threats to seniors over 60. According to the American Cancer Society, people over 65 account for more than half of all skin cancer cases in the U.S. And the scary part? The signs of skin cancer often seem harmless at first, until it's too late. Hi there, and welcome to Golden Aging Health. In this video, I'll guide you through 5 early warning signs of skin cancer, with a focus on melanoma, the most aggressive type. By the end, you'll learn how to apply the ABCDE rule, recognize subtle skin changes, why a simple check could mean the difference between life and death. When caught early, melanoma has a survival rate of over 99%, could literally save your life. So hit that like, subscribe, and stick with me. I'll reveal a powerful celebrity story that just might change how you see your skin. Let's protect your skin after 60 and age with strength, not fear. Symptom number 1. A mole that changes shape or size. I remember hearing about legendary reggae musician Bob Marley, who was diagnosed with melanoma, but not on his face, arms, or back like most expect. Instead, he had a dark spot under his toenail that he first thought was just a soccer injury. For months, it looked like a simple bruise. But when it didn't heal, he finally sought medical help, only to discover it was acrolentiginous melanoma, a rare but dangerous form of skin cancer that tends to appear on the palms, soles, or under the nails. Unfortunately, by the time it was diagnosed, the cancer had already spread to other organs. According to Harvard Health, asymmetry is a key part of the ABCDE rule for spotting melanoma. As we age, skin after 60 thins and loses elasticity, making mole changes more noticeable. A 2020 study in the Journal of the American Geriatric Society found that 30% of melanoma cases in seniors showed asymmetry as the first symptom. This is where the ABCDE rule becomes a lifesaver. A for asymmetry. One half of the mole doesn't match the other. B for border. The edges are ragged or blurred. C for color. It's not uniform. You may see black, brown, tan, or even red and white. D for diameter. It's bigger than a pencil eraser, about 6 millimeters. E for evolving. It's changing, and change is what makes doctors worry. To check for this, grab a mirror and inspect moles monthly. Look at your arms, legs, and even hard-to-see spots like your back. Use a hand mirror or ask a loved one. If you spot asymmetry, don't panic, but book a dermatologist appointment. Ask your doctor, could this be a skin condition like melanoma or basal cell carcinoma? Early detection of skin cancer symptoms is critical for senior health. But here's the tricky part. Sometimes it's hard to know whether you're looking at something dangerous or just a harmless age spot. If you've ever found yourself wondering about that, I made a full video just for you called Skin Cancer or Age Spots: 5 Warning Signs Seniors Must Watch For. It breaks down how to tell the difference between the two, especially for aging skin. I'll link it below and in the end screen, so be sure to check it out after this. Have you noticed any uneven moles on your skin? Share your experience in the comments. It might help others. Symptom number 2. An open sore that won't heal. Here's a symptom many people mistake for something harmless. An open sore, scab, or crusty patch that just won't heal. Now, it's common for seniors to get little nicks, scratches, or dry spots on their skin after 60, especially if you're on blood thinners or have thinning skin. According to Mayo Clinic, this is one of the most common signs of basal cell carcinoma, the most frequently diagnosed skin cancer in the United States. And while it's not usually fatal, it can be deeply invasive and disfiguring if ignored. Don't miss these warning signs. A scabbed area that keeps breaking open and rescabbing. A pale patch or shiny bump that oozes, crusts, or bleeds. A flat sore with a scaly crust, especially on sun-exposed areas like your face, neck, ears, or hands. Cancerous skin cells disrupt normal healing. They multiply uncontrollably, creating tissue that the body can't properly repair. That's why these sores look inflamed or irregular and never fully close. Let me tell you about a case reported in the Journal of the American Geriatric Society. A 68-year-old woman noticed a flaking patch on her nose that bled occasionally when she washed her face. She thought it was just dry skin or eczema. 6 months later, it was diagnosed as squamous cell carcinoma, requiring surgery. I recommend using what dermatologists call the 3-week rule. If a skin lesion, spot, or sore hasn't healed in 21 days, it's time to get it checked. You can also take a photo each week to track changes visually. Now let's move to another warning that surprises many seniors. A sudden, itchy, or bleeding spot that seems to appear out of nowhere. This next sign often gets mistaken for a bug bite or dry skin, but it can be far more serious. Symptom number 3. A sudden, itchy, or bleeding spot. Have you ever felt an itch or sting on your arm, only to discover it's coming from a mole or patch of skin that never used to bother you? That's not just irritation. It could be your skin sending out a warning. According to the National Cancer Institute, itching and bleeding are often under-recognized signs of skin cancer, especially among seniors who may already deal with dry or thinning skin. Be aware of this. A new spot that's itchy and keeps you scratching, especially at night. A mole or bump that starts to bleed without being picked or injured. Any area that oozes or crusts, heals, and then starts over again. These symptoms happen because cancerous cells can damage nearby tissues, break fragile capillaries, or trigger immune responses that cause inflammation and itch. Then suddenly, it bleeds when you dry off with a towel. That progression of symptoms, especially after 60, is never normal. Gently run your fingers over your skin, especially areas you can't see easily, like your back, scalp, or behind your ears. If you feel a rough, raised, or bleeding area, even if it's small, use a mirror or ask a loved one to help inspect it. Don't wait for it to grow. If you have a loved one over 60, share this video with them. It might be the gentle warning they need and the reason they catch skin cancer before it's too late. Not all warning signs are dramatic. Some changes slip under the radar because they're mistaken for harmless growths like a cyst or skin tag. Symptom number 4. A dark spot in an unusual place. Here's where it gets surprising. Skin cancer doesn't always show up where you'd expect. Most people only check their arms, face, or neck. But melanoma can appear in hidden, unusual places, including the scalp, between your toes, under your nails, and even in the groin area. According to OncoDaily and the National Cancer Institute, this type of skin cancer is more common in older adults and people with darker skin. Because it hides in hard-to-see places, it's often diagnosed late, when treatment options are more limited. But even fair-skinned individuals aren't immune. Yes, Wolverine himself. Actor Hugh Jackman has had over 6 skin cancers removed, mostly basal cell carcinomas. But in an interview, he said, "It's just a basal cell carcinoma. It's no big deal. But if I can just encourage you to go and get checked." He now urges everyone, especially those over 60, to wear sunscreen daily and get regular skin checks. These 2 cases, Bob Marley and Hugh Jackman, show us that skin cancer can strike anywhere at any time, regardless of your lifestyle. The key is knowing what to look for. Things you should be cautious about. A dark stripe under your nail that doesn't move as the nail grows. A pigmented spot on the sole of your foot or in between your toes. A pale or reddish lesion on your nose, lips, or ears that keeps coming back. Use a handheld mirror to inspect tough-to-see places or ask a loved one for help. Take photos monthly to compare subtle changes. Skin cancer doesn't always shout. It whispers from the shadows. Whether it's hiding under your nail or on your scalp, early detection is your best defense. So check the places you usually ignore, and don't wait for pain to tell you something's wrong. Now, what if something new does show up? Something that wasn't there before and just feels off. Symptom number 5. A new growth or bump that feels different. Not all signs of skin cancer look scary. In fact, some are so subtle that people barely notice them, especially this one. A new bump or growth that simply feels different. As we age, our skin tends to develop more growths, seborrheic keratoses, age spots, and skin tags. But here's the key difference. Most benign skin growths are soft, symmetrical, and stay consistent over time. Cancerous growths, especially those linked to basal cell carcinoma or melanoma, often have a firm or waxy texture, and they slowly evolve. According to Mayo Clinic, a common presentation of basal cell carcinoma is a pearly or flesh-colored bump that's slightly raised, firm to the touch, and may even have tiny blood vessels running through it. Here's what could surprise you. A new bump that wasn't there a month ago, especially on the face, chest, or shoulders. A raised lesion that has a translucent, shiny surface. A spot that starts as a small growth but becomes thicker or firmer over time. After a shower, use your fingertips to lightly scan areas like your scalp, neck, shoulders, and back. If a spot feels oddly firm or has changed consistency, take note and monitor it weekly or better. Show it to a dermatologist. Have you or someone you care about ever noticed a strange bump or growth that turned out to be something serious? Drop your story or concern in the comment. Your experience could help someone else spot the signs of skin cancer earlier. We're all learning together, especially as we care for our skin after 60. Let's take a moment to review the 5 key symptoms of skin cancer after 60 that every senior should know. A changing mole, especially one that becomes asymmetrical, grows or changes color. A sore that won't heal, particularly one that lingers longer than 3 weeks or keeps scabbing. An itchy or bleeding spot that appears suddenly and doesn't resolve. A new growth or firm bump that feels different than the rest of your skin. A dark spot in an unusual place, like under your nails, on your scalp, or between your toes. Catching these early can mean the difference between life and death. According to the Skin Cancer Foundation, when melanoma is detected early, the 5-year survival rate is 99%. But if it spreads, that number drops drastically. One simple habit that could save your life. Do a monthly skin check in the mirror. Front, back, underarms, between toes. Use your phone to take pictures and compare each month. If you notice any changes, don't wait. Book a dermatologist appointment, even if it feels too small to worry about. If you found this helpful, give it a like and subscribe to Golden Aging Health. And don't keep this info to yourself. Share it with a friend, a partner, or someone you love. You might help them catch something before it becomes dangerous. You're not just aging, you're aging smart, strong, and informed. Thanks for watching Golden Aging Health. Stay safe under the sun, and I'll see you in the next video.